Focus on the fact of the matter: why are half of Americans obese now when it never used to be that way? Have you noticed how many Americans have become overweight or obese in recent years? It seems like everywhere we turn, there's another fast food chain or sugary snack tempting us to indulge. But why is this happening? Why are half of Americans now considered obese when it never used to be that way? In this blog post, we'll explore the history of obesity in America, the role of genetics and the environment, psychosocial factors, as well as the consequences and solutions to this growing problem. Get ready to focus on the fact of the matter. Overweight and obesity in America. Overweight and obesity have become major health concerns in America, affecting not only adults but children as well. According to the Centers for Disease Control and Prevention, CDC, over 42% of American adults are obese, while roughly 18.5% of children between ages 2 to 19 are considered obese. Obesity is defined as having a body mass index, BMI, of 30 or higher, whereas overweight individuals have a BMI between 25 to 29.9. These conditions increase the risk of various diseases such as heart disease, diabetes, stroke and certain cancers. The prevalence of obesity has increased significantly since the mid-20th century when it was relatively rare. Today's modern lifestyle is characterized by less physical activity and more sedentary behavior coupled with access to high-calorie foods that promote weight gain. The rise in obesity rates can also be attributed to economic factors such as poverty and food insecurity, which limit access to healthy food options and encourage reliance on cheap fast food meals that are often calorie-dense. Understanding the scope of overweight and obesity in America is crucial for developing effective strategies towards prevention and treatment of this growing problem. The history of obesity in America. The history of obesity in America dates back to the early 20th century when industrialization and urbanization started taking place. With the rise of factories, people started moving from rural areas to cities in search of work. This shift brought significant changes to their lifestyle, including a change in diet. Processed foods became readily available, and people started consuming them more frequently than before. The introduction of fast food chains also played a role in contributing to the trend of unhealthy eating habits. During World War II, rationing led to limited access to food for many Americans. However, after the war ended, there was an abundance of food that was cheap and easily accessible due to government subsidies. In recent years, technology has made our lives easier but has also contributed significantly to sedentary lifestyles. Children spend more time indoors playing video games or watching TV instead of engaging in physical activities like they used to. It is clear that various factors have contributed over time towards making obesity such a prevalent issue across America today. The role of genetics. Genetics play a significant role in determining an individual's susceptibility to obesity. Researchers have identified several genetic variations that contribute to body weight regulation, metabolism, and appetite control. Studies show that certain genes can influence the way our bodies store fat or respond to food intake. For instance, some individuals may have a gene variant that causes them to feel full quickly after eating, while others may not experience this sensation until they've consumed more food. Moreover, research has shown that genetics also interact with environmental factors such as diet and physical activity level. Individuals with a higher genetic risk for obesity are more likely to develop the condition if they consume unhealthy diets or engage in sedentary lifestyles. While genetics cannot be changed, understanding their role in obesity can help individuals make informed decisions about their lifestyle choices. A balanced diet and regular exercise can help mitigate the effects of genetic predisposition towards obesity and promote overall health and wellness. The role of the environment. The environment plays a significant role in the obesity epidemic. There are many environmental factors that contribute to weight gain, including easy access to high-calorie foods and beverages, decreased physical activity levels due to changes in our work and leisure activities, and an increase in sedentary behavior. One of the main reasons why Americans have become more overweight is the increasing availability of fast food restaurants. These establishments offer cheap, convenient meals that are often loaded with calories, unhealthy fats, sugar, and salt. On top of that, people today are eating larger portions than they did in previous generations. Another factor contributing to obesity is the prevalence of technology like smartphones and streaming services, which has led people to lead increasingly sedentary lifestyles. People can now binge watch their favorite shows for hours on end without ever leaving their couches or getting any exercise. Additionally, there's been a decline in daily physical activity levels as jobs shift from manual labor towards desk jobs, making it harder for adults, particularly those who live far away from their offices or lack time after work hours, to engage in enough physical activity. Environmental factors play a crucial role when it comes to maintaining healthy body weight. We must start considering how we can change our environments so they are supportive rather than hindering our health goals. Psychosocial factors. Psychosocial factors are another significant contributor to the obesity epidemic in America. These refer to the psychological and social influences that impact a person's eating habits and physical activity levels. One such factor is stress. Stressful life events can lead people to adopt unhealthy eating behaviors as a way of coping. Additionally, when individuals feel stressed, they may be less motivated to engage in physical activity. Another psychosocial factor is depression. People who suffer from depression may turn to food for comfort or experience changes in their appetite that can lead to weight gain. Social support also plays a role in maintaining healthy habits. A lack of social support can make it challenging for individuals to maintain healthy eating patterns or stay active regularly. Furthermore, cultural norms around body size and shape can also influence an individual's perception of themselves and their willingness to pursue healthier behaviors. Recognizing and addressing psychosocial factors is crucial in tackling the obesity epidemic effectively. The consequences of obesity in America. Obesity in America is not just a cosmetic issue, but it has serious health consequences. Being obese increases the risk of developing various chronic diseases such as type 2 diabetes, heart disease, stroke, and certain types of cancer. In fact, obesity-related illnesses are responsible for approximately 300,000 deaths annually. Aside from physical health problems, obesity also affects mental well-being. Obese individuals often experience social stigmatization and discrimination, leading to low self-esteem and depression. They may also find difficulty in finding jobs or being promoted at work due to bias against their appearance. The economic costs associated with obesity are staggering too. Obesity-related medical costs amount to billions of dollars each year, with direct and indirect expenses including medical bills and lost productivity. These costs affect both individuals who struggle financially paying for healthcare services and taxpayers who have to foot the bill for public healthcare programs. It's important that we address the consequences of obesity by taking steps towards prevention, like healthy eating habits, regular exercise routines, along with psychological support programs which focus on building body positivity among individuals struggling with their weight so that they can live healthier lives free from these underlying issues affecting them today. The solutions to obesity in America. The solutions to obesity in America are multifaceted and require a combination of individual, community, and policy-level changes. Firstly, individuals need to take responsibility for their own health by making lifestyle changes such as incorporating more physical activity into their daily routines and adopting healthier eating habits. This can be achieved through setting realistic goals, seeking support from family or friends, and consulting with healthcare professionals. On the community level, it is essential to provide access to healthy food options such as fresh fruits and vegetables at affordable prices. Additionally, promoting physical activity opportunities like walking or biking trails can help encourage people to incorporate exercise into their daily lives. At the policy level, government initiatives that promote healthy lifestyles can play a crucial role in addressing obesity. These include implementing taxes on unhealthy foods like sugary drinks while providing incentives for businesses that offer healthier options. Furthermore, supporting child nutrition programs in schools can have significant impacts on reducing childhood obesity rates. Addressing the issue of obesity in America requires a comprehensive approach involving individuals taking greater responsibility for their health choices while also requiring changes at both community and policy levels to create an environment conducive towards healthy living practices. Conclusion. The obesity epidemic in America is a complex issue with multiple factors at play. Genetics, environment, and psychosocial factors all contribute to the high rates of overweight and obesity seen today. The consequences of this epidemic are severe and far-reaching, from increased risk for chronic disease to decreased quality of life. However, there is hope for change. By implementing evidence-based solutions such as promoting healthy eating habits and increasing physical activity levels at both individual and societal levels, we can begin to reverse this trend. It will take dedication from individuals, communities, businesses, and policymakers alike to create lasting change. By focusing on the fat of the matter, addressing root causes rather than just symptoms, we can work towards a healthier future for ourselves and generations to come. Let's start making positive changes today.